Okay guys, aloha, Dr. Thomas coming back at you once again. Okay, this is where we left off with the previous video. Agonists, antagonists, selective action. Stimulants increase cell activity like caffeine and coffee. Depressants decrease cell activity such as the painkiller morphine. Fundamental action of drugs. Local action directly at the site. Remote action an area other than where given. Systemic action carried throughout the body of the bloodstream. Fundamental actions of drugs. Specific works on specific organisms, like a antibiotic that's geared towards a specific, or synergistic potentiates actions of another drug, cranks up another drug. 4 basic stages of drugs' life in the body: absorption, distribution, metabolism, where it's broken down or whatever, and then finally waste products and so forth are excreted from the body. The liver is charged with doing a lot of that. Yes. Undesirable action of drugs. Side effects may limit usefulness of the drug. Action other than the intended action. A big one is allergies, guys. There's some of these drug allergies that can be really, really severe. Penicillin, there's a lot of people allergic to that, for example. So you always have to check for allergies. They may be mild, like rashes, hives, itching. May be severe and require immediate attention because they can go into anaphylactic shock and die. Adverse reactions, unfavorable or harmful unintended action may be reported to the FDA. Now, of course, you notice, guys, on drug containers and bags and stuff, there's like 2 pages of information about all the potential problems with it. Drug interactions, potentiates, increases the effects of another drug. Diminishes it, decreases it. For example, antibiotics and oral contraceptives. Antibiotics, apparently, with some oral contraceptives, diminish its usefulness or its biological activity. Okay, medical administration essentials, Unit 10. Remember, that's the same thing as saying Chapter 10. Legal implications. Those who administer medications must be legally and ethically responsible for actions, licensed, registered, or authorized by the physician, familiar with state laws, familiar with the drugs being given. Okay, guys, this is real important. Now, we talked about the scheduling in the previous video. That's important, the 5 schedules. The 10 rights of proper drug administration. Sometimes you'll see 5 or 6 rights, but this is the 10 rights. It's continued on the next screen. Has to be the right patient, the right drug, the right dose, the right route. Might have to be injected rather than a pill, for example. Given at the right time. It has to be accompanied by the right documentation. All this stuff, guys, has to be put in the patient's chart. Right technique. Right date and time with documentation. Right to educate. And finally, the patient has a right to refuse. They may not if they're under 18, but you'll frequently see this as the 6 rights. They'll usually stop here, but go ahead and learn this too, guys. This is super, super important. One of the big things in this class you need to know. So I'd get on it right now. Right patient. Call patient by name or ask them to state their name. Why? To make sure you got the right person. That's why. Do not rely on staff to identify your patient. Patients in physicians' offices don't wear ID bracelets like they do in the hospital. Warning, if a drug is not given, you must state why. You must properly dispose of drugs not given. Why, guys? You'd be amazed at the number of nurses and doctors and other healthcare people who siphon off drugs from their patients to feed their own habit. I don't want that. I don't want you to take that worse than what it is, but it is a real problem. So you must dispose of them and document it. Why? Otherwise, you can't be slipping them in your pocket. Right drug. Check the label 3 times. When taken from storage, check it then. Before removing from the container, check it then. And finally, when returning container to storage or prior to discarding, check it. Why, guys? Until the COVID virus, medical mistakes was a 3rd leading cause of death in the United States. And I forget, nearly 500,000 a year. No, that's cancer. COVID last year was the 3rd. And so this is an enormous problem, guys. And drugs is not the only cause, but it's a big one. Right dose. Have proper knowledge of drug calculations. Have another person verify the accuracy. Always compare dosage ordered to what you have on hand. Right route. Check the medication order for the correct route. Some of them can be given orally, some have to be given by injection, etc. Be familiar with all routes which particular drugs may be given. If the route is not specified or if in doubt, verify with the doctor, guys. He or she might get aggravated, but hey, it's their butts that are on the line. So if you have a question, they can darn sure shut up and answer it. Or answer it and then shut up. Right time. Check the time interval specified in the medication order. It might have to be given on an empty stomach. It might have to be given after a meal because it's a known stomach irritant. To maintain a drug at the proper blood level, timing is essential. Right technique. Know and follow the proper techniques for any drug administered. Use the 10 rights and specific physician instructions. Consider safety measures. Follow specific preparation techniques. This is particularly true, guys, with injectable drugs, where there's a very standard way of doing it in a certain way, as there should be. Check medication label for specific directions. Write documentation. The chart is a legal document, guys. The patient's chart is a legal document. It must include the patient name, date and time of administration, medication name, dosage, route and site, any adverse reactions. Hopefully there are none, but complications in administration if there were, signature of administering staff. Chart is a legal document. Who does it belong to, guys? And who said it belongs to the patient? You're wrong. It belongs to the facility. The patient has a right to a copy of it. Essential medication guidelines. Practice medical asepsis. Means use a sterile needle, etc. Work in well-lighted area without distractions. Follow the 10 rights of proper drug administration. Check for allergies before administration. Give only drugs authorized or ordered by the authorized prescriber. Guys, when you get done with your program here, you're going to know a lot, but you're still not a doctor or you're not a nurse. They have a lot more training than you do. So don't try to outguess them. Sometimes they're wrong. Oh, yeah. But still, that's not your job or responsibility. Essential medication guidelines. Check the expiration date. Do not give a drug if it's altered in any way. Give only those medications that you prepared. Why? Because only you know for sure what you did. Don't let somebody else prepare, another MA, your colleague, and then so they run off to lunch and leave you with it or something. Do not allow someone else to give the medications you prepared. This is in line with what I just said here. Never give medication if there are questions about the order. Ask them, guys. They may get miffed. Particularly in family medicine now, they're real busy. They're out there hustling all the time because the insurance companies don't reimburse or pay what they used to pay, so they have to see more people. I just put it on the line, guys. I've been in healthcare coming up on 35 years. And ask them. Like I said, the doctor's butts are on the line here too. More so than yours. Essential medication guidelines. Confirm the order with prescribing physician. Be completely familiar with drugs that you're giving. Do not leave prepared medication unattended. Why? Somebody might mess with it or something might happen. Stay with the patient until you are certain the medication has been taken. Keep drugs in safe storage space. Many drugs, guys, have no real street value, but a lot of them do. And people will take them, man. Oh, you wouldn't believe it. Now, I'm a chiropractic doctor, so I don't prescribe medicine. But I worked in family medicine in the 90s in Florida for 5 years. You wouldn't believe this nice little lady that goes to church 3 times a week coming in that's trying to scam me out of more pain pills. Oh, my nephew, he came over and he took them. I dropped them in the toilet. They went out the window of the car. My dog ate them. Yeah, you wait and see. Essential medication guidelines. Shake or mix preparations that contain a precipitate before pouring. Precipitate, guys, is it's a chemical term, when you've mixed a solid in with a liquid and it kind of settles out. That's precipitation. Well, you want to mix it back up. Measure at eye level. Why? You got to be able to see that, guys, especially when preparing a injectable drug. Measure from the lowest point of the meniscus. Now, we don't know what that is yet. When you fill a hypodermic needle with a medication, it forms, it's not straight across. And at the lowest point, you have to specify exactly where you're going to fill to. Do not touch the bottle to the measuring device. Do not contaminate the cap. Why? Well, they use this bottle of medication over and over again until they run out. Whole bottle with label toward the palm. Universal precautions are infection control measures. Reduces the risk of transmission of blood-borne pathogens like HIV, and that sort of thing. Hepatitis are big ones. Blood and body fluids. All persons are treated as if contaminated with human immunodeficiency virus, HIV, or hepatitis B, or other blood-borne pathogens. That's what universal precautions means, guys, is treat all patients as though they're already infected. Why? To be safe. To be safe for you. 6 universal CDC universal precautions. Combine universal precautions with body substance isolation. Applies to blood, particularly blood, all body fluids, non-intact skin, mucous membranes, fluids such as urine, but particularly blood. That's why they call them blood-borne pathogens. Safe storage of medications. Medication rooms should be well lighted so you don't make a mistake by misreading. Away from patient traffic. Why? Patients don't need to be around the meds. They might take them. Contains sink and refrigerator. Why? Some have to be kept cool. Plenty of cabinet space. Yeah. Safe storage of medications. By use, internal, external. Odic means in the ear, etc. By preparation, solid, liquid. By route, oral, topical, rectal. What if you messed up and gave somebody a rectal medicine and made them swallow it? My God, how humiliating. And plus, it probably wouldn't work either. By therapeutic action, analgesics or painkillers, antihistamines reduce snotty nose and stuffy, Alphabetical, generic and brand names. Principal action, stimulus, depressant, etc. Action of drugs by body system. So there's different ways to catalog all this stuff, guys. Safe storage of medication. Some drugs require special storage, like opaque containers, like a brown bottle instead of a clear one. Some refrigeration, some have to be stored in glass containers. Samples are kept separate from other medications. Guys, in the 5 years I was in family medicine, there was a pharmacy rep that came by from various companies just about every working day, business day. And I always liked them. I would talk to them. They're very well trained. They know science and chemistry real well. And they'll come up, they'll wait around until they get a chance to talk to the doctor. They'll say, hey, Dr. Smith, here's our newest, and they'll show it. This is a such and such precipitate that works on the hypothalamus and what have you. But they also would leave samples, and that's good. I liked samples for the simple fact, guys, that the doctor had a locking little closet full of the samples. Why? Because you can give them to the patients whose insurance doesn't pay or they don't have any money, or you can give them a sample to try it first and see if it's going to work. Medicine is a business, guys, and it's run by the insurance companies, and things are expensive, and it's wild. But the samples you want to keep separately. So the samples are good. I always liked it. Plus, sometimes these pharmacy companies will put on a big shindig with an open bar and ribeye and all that Dr. Tom got to go to. Safe storage of medications. Controlled substances stored in a locked box. The ones like pain pills and all that people want. Poison substances labeled in red. All medication checked on a regular basis to guarantee freshness. We're moving along because I want to finish. Emergency medication. Be familiar with the location of emergency medications and supplies. Be familiar with your role in the event of an emergency. Medication supplies be checked separately. If there's an emergency, guys, guess what doctors do? The same thing we do. They call 911. I've seen it happen. Documentation of drug administration. Patient name, date, time of administration, medication name, dose, route, site, technique, adverse reactions, hopefully none. Continued complications in administration, if there were any. Patient data, blood pressure, pulse, respiration, those are called vital signs. And if the medication was not given, state why and dispose of the medication. Don't try to put it back in the bottle. Effectiveness, signature of administering staff. Medication error. Drug given to wrong patient, wrong drug, wrong dose, wrong route, wrong time, wrong technique, wrong data. Recognize the error, stay calm, assess patient, report to physician, follow physician's orders. Document complete incident report. When administering, create written documentation, patient's name, prescriber's name, date, time, medication, nature of reaction. Recognize the error, name person who administered the drug. This is Dr. Tom signing off. Great, we finished.